Countercurrent mechanism of urinary concentration. The isoosmotic glomerular filtrate is generated in the Bowman's capsule, and then the fluid descends through the descending limb of loop of Henle. But when the fluid descends, it leaks water. That means it loses water from descending tubule to the medullary interstitium, and concentration of the fluid that is descending through the descending limb of loop of Henle is increasing, and concentration is maximum in the loop of Henle, tip of the medulla or tip of the loop of Henle. And when the fluid is ascending, this concentrated fluid is ascending through the ascending limb of loop of Henle, there is active process of concentration mediator maker. What is the active process? The tubular epithelial cell absorbs from the tubular fluid this sodium, potassium 2 chloride, and calcium, magnesium through the paracellular pathway. These minerals are absorbed actively from the thick ascending limb of loop of Henle. So there is large amount of electrolyte concentration in the medulla. As medullary electrolyte concentration is maximum in the tip, so concentration is maximum in the tip. Fluid ascends and electrolyte is reabsorbed. But when the fluid ascends more up, the electrolyte becomes depleted, so the concentration from the tip to above is decreased, and fluid ascending from the ascending limb of loop of Henle is diluting. Look, the mechanism is this: the fluid descending through the descending limb of loop of Henle is permeable to water only, so it loses water because of this concentration mechanism. Here a large amount of electrolyte, that is sodium, potassium, chloride, calcium, magnesium, large amount of electrolyte, this is active sucking water, or this is sucking water from the descending limb. So descending limb fluid is continuously being concentrated, and the fluid is coming here, is losing electrolyte only, not water, electrolyte only into the medulla. So this electrolytes is being concentrated in the medulla, and medullary concentration is maximum. When the fluid is going through this pathway, it is being diluted continuously, and minimum dilution is here. When body needs to preserve water, ADH is secreted. ADH opens aquaporine 2 channel in the collecting tubule and collecting duct. It causes leaking of water from the collecting tubule, collecting duct into the medullary interstitium through this concentration gradient, because this is whole medulla, and this is whole totally concentrated, highly concentrated, up to 1200 milliosmol per liter due to this sodium, potassium 2 chloride and calcium, magnesium. Understand? I think you understand. When furosemide is given, this inhibits the sodium, potassium 2 chloride channel, ultimately calcium and magnesium, so the medullary concentration is impaired and water reabsorption is hampered. So furosemide is the drug that impairs medullary concentration or countercurrent mechanism, and also decreases water absorption greatly. It is highly effective in case of acute treatment of any edema. I want to speak this thing once again. Water descending through the descending limb of loop of Henle is continuously being concentrated because it is losing water. The water moving through the ascending limb of loop of Henle is continuously losing electrolyte, sodium, potassium 2 chloride, calcium, magnesium in the medulla. So medulla is continuously being concentrated, and ADH mediated water reabsorption totally depends upon the medullary concentration. Thank you.